introduction, we'd like to engage the autistic community and the people within the hub in all the different stages of research, from the generation of research questions. I like to say this because it's very true. Sometimes researchers tend to be sitting in a bubble and think, oh, this wouldn't be nice to research this, and they have their own ideas of what they think will be interesting to research. But when you go into the community, the needs and the aspirations for research for that community can be very different. So we like to include the voices of the autistic community into the research that we do. And we like to capture their experiences and using kind of methodology that is accessible. Sometimes we work with autistic people who come into the early stages of the design of the research projects. Sometimes we involve them in the methodology, and sometimes we also involve them into the data analysis and train them sometimes on how to analyze a certain type of data, or even to help us with the interpretation of the data, and that is the outcome of that research. And the hub also provides opportunities for students. So student research projects, they come and get engaged and advertise their studies. You know, they engage with the people that come to the hub and tell them about the project. The community engagement is also very important. And we work also in partnerships with healthcare and third sector organizations. And these are like a whistle-stop tour of some of the examples of the projects that we have been working on. One of them, for example, is a virtual reality study, and this one is based on a virtual reality simulation, autism simulation tool, and it's been developed with the idea of training employees and, you know, different kind of sectors, even in education as well, to understand the sensory sensitivities of autistic people. It illustrates different everyday scenarios, you know, like a coffee shop or a school environment or an open office environment. And it just shows how how the sensory world can be, how noises can be merged together and create this sensory overload, or how light can be just so, you know, overbearing that it's very difficult to focus. And what we have seen with the study that we've conducted is how this tool can be used to actually understand what autism is. One thing is to hear about it or to read about it. But when you actually step into using this tool into the world of a sensory world of autistic people, we have found that it increases empathy, increases understanding and perspective taking of individuals with autism. We've also done some work on the diagnostic pathways and mental health in autistic adults, and we have found through this research the impact that a delayed diagnosis can have and how they can be linked to long-lasting masking behaviors, and how that can make sometimes the diagnosis process more difficult. We've also found that there are significant barriers accessing diagnosis because of the long waiting lists, because of the criteria that is used sometimes for assessment, and how the lack of support can have an impact on these individuals. And another of the projects look at the support available in the workplace and within the clinical settings. So, for example, we have found that healthcare professionals report limited training in autism and neurodiversity, that employers are uncertain about reasonable adjustments and disclosures, like what to do and how to best support neurodivergent individuals. And I'm just going to give you now an example of some of the other projects that we have been doing. It's not just research. We like to get involved into turning the University of Liverpool into more neurodiversity friendly. We ran an arts competition last year, where we invited neurodiversity students, staff, and anyone who wanted to take part into expressing through art what their neurodivergent identity. And we had so many beautiful and compelling emotional entries that we organized, and that ran during the whole of February, an exhibition in the Sidney Jones Library. And And the feedback was amazing. But what we also did, we created a space in which people had interactive, we left post-it notes and pens, and people could leave their own messages into what, you know, anyone that came to see it and felt that they could identify as neurodivergent, what it meant to them. And some of those messages are really, really powerful. I couldn't, you know, when the exhibition finished, I just wanted to bring them back in there outside my office. And what happened is something really nice. A lot of people that pass by have also keep posting more messages around it, and it's really moving to read them. We have a little bit of money from the university with an organization called James Cape, which are alumni. They are a software development company from the alumni from the computer science department who created this company, and a lot of them are neurodivergent, and they reached out to us, and we worked together in this application to provide some training to staff about neurodiversity that could help support students and colleagues on what it is. So if anyone here is interested and is part of the University of Liverpool, we would love to hear your comments and how you'd like to feel supported, because this will be included in the actual training. We're planning to run pilots before the end of the academic year, and hopefully, with the good outcomes, we'll be able to roll it out to the whole of the university. And this is, I'm nearly done. And this is another little project that we're running from the hub. There is a sensory space in the Sidney Jones Library, a sensory room, and it's not very widely used. Many people don't even know that it's there, and it needs some improvement. So we are running this survey to try and get feedback from people on how they use it, why they don't use it, and if they do use it, how it can be improved. And the idea is to use that data to apply for funding to actually drive some improvement into that space. And finally, our next Autism Hub is on the 12th of June. We've run several in the year. We had one in February. Yes, please join us if you have never joined us before. Everyone is welcome. You don't have to be part of the university. Anyone with an interest in autism can come and join us. That's it. Thank you very much.